Hi guys, welcome to another interesting episode of Gist with Essay. Please don't forget to create a watch party if you're joining us on Facebook, and remember to send in your questions if you're joining us on Facebook or YouTube to our guests. Okay, you can send the questions in the comment section and our guests will answer your questions. Also, if you'd like to call in on the show, the number to call is +4474 666 951 641. I'll take that again, +4474 666 951 641, and you can get us on that number on WhatsApp directly. Today, our guest on the show is Dr. Yinka Akindeko. She's a certified physician, an anti-aging doctor, a public speaker, and the founder of her own skincare range. Yeah, that's an image of her skincare range. She's going to be talking to us about anti-aging skincare and giving us tips on how to maintain a youthful look. So let's get the gist started by bringing in our guest. Hello, Dr. Yinka. Welcome to Gist with Esse.
Hi, Esse. Hi, everyone. Thank you for having me.
Yeah, so before we go into the main gist, tell us a bit about yourself, your background and all.
I am a doctor, so I trained in University of Ibadan in Nigeria, and then moved to the UK and worked many years in the UK. I trained as a family physician. That's general practitioner, we would call it in the UK. And now I have moved to Canada. So I'm in Canada at the moment. So I've spanned across a few continents. But otherwise, I'm a mother to two boys, and I've got a big family, lots of siblings. My husband's got a big family as well, lots of siblings, so and lots of friends.
Wow. Okay. Out of curiosity, yeah, you you moved to Canada. Is it for work or you just decided you were tired of the UK?
There were so many reasons. Work was part of it. Then I've got family in North America as well, so I wanted to be closer to family. Then I've always wanted to live in different places. So I remember once saying to my husband, I want to live in India. And he was like, where did that come from? I wanted to live in Australia. So I think it feeds into my ideas about myself.
Okay, fantastic. Well, I like to travel a lot as well, but I'm not sure. I don't like moving though. If I wanted to relocate and there was a situation where I'll just close my eyes, wake up the next morning, I'm at, where I want to be without having to move, and I will do it. But otherwise, I'm okay with just traveling around the globe.
So when the teleportation tool comes, when Elon Musk releases it,
I'm going to be one of the first people. Yeah.
Yeah.
Sign up for that.
Mm.
Yeah, because parking takes a toll. It's a lot of stress mentally, more mentally than physically, if you ask me.
Yes.
Yeah, so let's talk about skincare routine. What's a good skincare routine that everyone should practice on a regular basis?
So for me, I like to keep it simple because as you can imagine, I've just said to you, I'm busy. There's so much that needs to happen every day. You've got to pick up the boys, drop them, do this, do that. So I would say probably the most basic, most important skincare routine is to cleanse and have a sunscreen, right? Apply.
Okay.
Yes, that's the most basic, because you want to clean anyway. You want a clean skin, right? And you want to have sunscreen every day because there are some things we can change about aging. What you've inherited, we cannot change. What you've got from your parents, we cannot change. But the external factors we can change. And the biggest one of the external factors is the sun. So all the external factors, the sun causes the biggest aging process. So that we can change. And that's the one we should be dealing with first. So basically, cleanse and sunscreen. The other things you add on based on what you want for your skin. So, for example, a skincare routine, the Dr. Yinka skincare routine is you wake up, you cleanse your skin, you put on a vitamin C serum because vitamin C makes your skin glow, it evens out your skin, is an anti-aging, and then you put your sun protection. So in the range, there's an SPF 50, and then you put your makeup as you want. In the
Okay.
evening, you cleanse again, you take off the grime of the day, and then you add on a retinol, for example. Or if you're treating something, if you're treating acne, maybe your doctor's giving you some treatment for your skin, then you put that on at night and you go to bed. So that's a basic skincare routine that's
Okay.
for most people to do.
Okay, good. So is it compulsory, like say you do it in the morning, but you don't go out in the sun? Do you have to repeat it again at night?
So you don't put sunscreen on at night because you're
No,
most.
not the sunscreen, just the basic cleansing. So, for example, I have done the morning routine, but I'm home all day, so I haven't exposed myself to the sun. Yeah, can I just wash my face and go to bed?
You can. It depends on what your skincare goals are, right? So if
Okay,
you want to start fighting lines and wrinkles, if you want to even out your skin tone, then a nighttime is a good one to put your retinol on. If you get
okay,
breakouts, so it's good to get into a routine. Now I'll answer the question in a different way. Because you've had a long day, you're busy, you don't want to do anything at night. The
mhm,
cheating way is to put some baby wipes next to your bed. Always have those baby wipes next to your bed. Leave
okay,
your nighttime cream next to your bed. So maybe it's a retinol. Then you just wipe the dirt off and then
mhm,
put your night cream on. So that way you're not getting up and going to do stuff. You still
okay.
achieve that aim without necessarily being stressed about it.
Okay, let's talk about aging itself now. Okay, we know that aging is part of life, and sometimes signs of aging on our skin can be wrinkles, loss of elasticity, sagging, dryness, amongst a whole lot of other things. But there are people who age prematurely. Okay, are there reasons for this, or does it depend on their skincare?
Yeah. So remember from at the beginning, I said there are two ways, there are two things that affect aging, right?
Mhm.
There's the intrinsic, so it's internal to you. You almost can't do much about it, right? You've inherited it. And there's extrinsic, so that's the environmental. Those are the things you put on your skin. That's what you eat. That's the lifestyle you lead. So those ones we can affect. So the ones, if your parents age really quickly, it might be hard to change that depending on why.
Okay.
But the things you can change, smoking, for example, smoking destroys collagen and affects how you age. Sugar, eating a lot of sugar and sweet foods affect how you age. If you sit in the sun, so if you take two women, actually there are pictures on the internet if you want to look at it. These twins, one worked indoors, so maybe she worked as a cleaner indoors or something, and
Okay.
one worked outdoors. Maybe she tilled the land. I don't know. Maybe she was a farmer or a market woman. And they put them side by side. They're twins, they're identical twins. And you can see how they've aged just based
Okay.
on being outdoors. Then there are things like what you eat, processed food. Those kind of things cause inflammation, affects how you age. The skincare products. So people that look after their skin, if you're putting retinol, things like that affect how you age. Botox will slow down the development of lines and wrinkles and help to smoothen out the skin. So there are so many things we can do to affect how we age. We can slow down the process, we can change the process.
Wow. Okay, so out of curiosity, the two ladies, obviously the one who works indoors aged better than the one who was exposed to the sun,
Mm-hmm.
right? Yeah, definitely.
Yeah.
So sometimes it can be something you inherited and there's nothing you can do about it.
Yes.
And sometimes, it's just your lifestyle,
Yes. Exactly. That's
from work to
so.
what you eat. it's funny how the things that we eat can, affect the outlook,
Yes.
of our skin, of our bodies. It's not just about, oh, you're adding weight and all of that, but actually how your skin actually looks over time can be dependent on the things that we eat.
Yes.
Wow.
The things we eat, the things we drink, alcohol in excess will affect your skin. You see a person, they haven't said anything. You see them, and based on their skin, you can almost give a story. Oh, you're looking good, Oh,
Mhm.
you don't look too good. What's happening? You can almost judge a person just by the way they look. And that's how it is in medicine. There are many internal organ problems that you can assess from a person's skin and how they look.
Wow. Okay, so we've got a question. Let's just take this question quickly. It's from Uche Olu, and she says, Dr. Yinka, can sun damage be reversed?
Some of it, yes. So, for example, if you have like those dark patches from sun damage, thanks, Uche, for the questions. I should have said that first. So, if you have like hyperpigmentation, like the dark patches from sun damage, that can be reversed. If you, so with the appropriate skincare, vitamin C can help with that, retinol can help with that, even things as harsh as hydroquinone used under supervision can help with that. But there are some things you can't reverse. If you've damaged a lot, if you looked online and you saw those sun worshippers, especially Caucasians, that sun worshippers, they've been in the sun, they love to sit in the sun, and they've done it for decades. When you see some of those damage, is very hard to reverse, but you can try. So there are lasers that can help with that, and skincare products that can help with that, fillers. So we use fillers, dermal fillers, injectables that can help with that as well. So yes, you can reverse some of the damage. If it's gone too far, then it becomes really hard to reverse.
Okay, so while you're reversing, do you have to then quit that lifestyle?
Of course.
You have to reduce the exposure to because some people are going to go do all that and then still go back to the same thing. So you have people doing it on a regular basis. Okay, so tell me, how does that damage your skin in the long run? So because we have a lot of people who do a lot of cosmetological, repairs to their skin. Yeah, that was initially caused by maybe smoking and maybe eating the wrong things and all of that. If you do all of these surgeries or these cosmetic repairs and all that, and you don't quit smoking and all these harmful habits, what happens?
You're just wasting your money. You might as well just throw it in the wind.
Wow.
There's no point. You really have to make the changes. Yes, it's true. You look better. So
Mhm.
if the skin's affected and you have some laser treatment and it boosts it up, or you're using skincare and then it helps for a while, but you're still causing damage. It's like essentially if you cut your skin, right, and it's healing, and you cut it again and you cut it again, how helpful is that? If you let it heal and do not damage it again, then that's a much better solution than going back to the destructive habits that caused the damage in the first place.
The first place. Yeah, true. Okay, wow, that's been very enlightening. So if I decide to go into, but do we really need it at the end of the day? For using a proper skincare range, do we really need to go to do all of the laser treatments and all that?
So they address different things. For example, if you have acne, right, and that's pimples, and one of the things we advise is to treat acne quickly because it can cause scars, right? If you have acne and then you have scarring from acne, so you have like those deep holes sometimes,
Mhm.
skincare helps, but sometimes you need laser. You need laser because skincare cannot go as deep as you want it to go. So some lasers might help with that. Dermabrasion, micro needling. I was going to micro needling can help with that. So even if you look after your skin, sometimes you need invasive sort of treatments to do the extra bit as well. Yeah.
Okay, thank you so much for that, Dr. Yinka. Before we continue, guys, remember to drop your questions in the comment section. And we need to take a short break. We're going to be looking at the spotlight of the week.
What are you turning to? I know. Upon the Esse will depot. Even the name of highlights are down. By the power of your wonder. I come to.
This is going to bad. Another giga. What to make you to that? Ogala is calling her. Come on, respond.
Okay, guys, that was a music video clip from Eni titled Oganla. Yeah, and at the end it said Oganla is calling, so come and respond. You can respond by going to check her out on her YouTube page at Eni. Yeah, Eni, to watch the full video and every other thing that she's done so far. Okay, Dr. Yinka is still in the house and we are still talking about anti-aging skin care. Now, you're a certified physician. Why did you decide to start making skincare products for people of color?
So when I finished my family medicine training, I was exposed to aesthetics as a specialty, and I started doing Botox and fillers at the time. But every time I did Botox and fillers, my patients would ask me about skincare. What should I use for my skin? This treats a little bit below the skin. How can I make my skin better? So I was advising, and then I started getting training myself because I wanted to offer better advice to my patients. So I was getting training, and one of the things that happened at the training was I realized many times the advice and the product wasn't geared towards skin of color, right? So for example, I remember being at a training and they were talking about hydroquinone, and this top doctor from somewhere was saying that hydroquinone does not cause any problems. And if it did, the treatment was more hydroquinone. And I just couldn't get my head around it because people bleach and destroy their skin, mainly because they want to lift some dark patches, they feel they want to glow, and they don't know what else to use. So I started doing educational live books, Facebook lives like you're doing now. So I started a page and I was doing Facebook lives, and that's where the products were born from, because people kept asking, oh, we want products. What product should we use? Can you make something for us? And that's when I made DYS essentially.
Okay, so talk to us about your products.
So the DYS skincare range, there are 4 products in there. There is something to cleanse your skin, and like we said, to get the grime and the dirt and the pollution of the day. And it's an alpha hydroxy acid wash. So alpha hydroxy acid breaks down the top layer, breaks down rough skin, helps your skin to be smooth, helps to even out color. So that's the first thing in the range. Then the second one is a 20% highly active vitamin C. It helps to give you a glow, makes your skin pop, evens out skin dark patches, and it's at 20%, which is a really good dose. The third is a sunscreen. So remember when I said that the most basic skincare range has sun protection and something to cleanse. And this particular sun protection, the one in the DYS range, is very hydrating. So for people that have dry skin and you're worried about extra moisturizing, this does the job as well. So hydrate your skin, it will protect you from the sun. It also has some lactic acid, which is an alpha hydroxy acid. So that helps to give you a glow, helps your skin to even out, helps with lines and wrinkles. Then the fourth product is the powerhouse, that's retinol. So in the industry, retinol is known as the most powerful ingredient. It reduces breakouts, so for people that have acne, and it helps to improve lines and wrinkles. It helps to even out skin color, and it's just an amazing product to have on your shelf for everyday use. So those are the 4 products in the skincare range.
Okay, so before I go to the next question, let's take a look at some questions and comments. Yeah, so Abiye Momodu says, what is the best way to reduce laugh lines?
The smiles. You smile with your eyes.
Okay, I need to learn how to do that. Okay, so show me.
I'm showing you already.
Yeah, because I always have a big smile. So tell me if I'm doing it well.
No.
Okay, so what? Let me look at you again and try again.
I don't even know if I'm doing it. I'm just trying.
Yeah, but I understand what you're trying to say. So with I can look into your eyes and see that, you know, you're happy. Okay, so you may not be laughing out loud, but I can see that. Okay, there's happiness in there. So
but on the serious side, though, so laugh lines sometimes is one of those things that we inherit. So we see even young people. So I'll see like a 15-year-old, a
yeah.
young person, they already have laugh lines. And
Mhm.
so what you can do, like we said, the reason you have it is because that's the muscle you use a lot. So you're a happy person. So that's the muscle you use, and it is what it is. But also, so using your muscles in a different way, that's one. Two, sun protection, like we said, retinol, like we said, but you can also have fillers. So that's one of the commonest places by far people have fillers in. And you put the fillers under the laugh lines and it just smoothens it out. And most of those fillers stimulate collagen anyway. So they prevent it from coming back for a while. And so those are things that people can do to help with the laugh lines if it bothers them.
Okay, so I'm going to take another question from Tommy Anoidem. He says, what are the side effects of your products?
Okay, Tommy, thank you. That's a good one. So, so any product, anything on the planet can have side effects. So remember, people are allergic to eggs and dairy and all of that. So some people might have like an allergy to the product. So they might develop a rash, for example. I haven't seen much of it. Actually, I haven't seen any, but I'm a doctor. That's for me to know that it's something that can happen. So if you're an allergic kind of person, you are allergic to everything, then maybe start slowly. Start with one product, see how you react, maybe a few days, just start really slowly. Something like retinol, for example, is such a powerful ingredient that many people find that they get dry and scaly with it. So you get like a flakiness. It is part of how it does its job because it increases your skin's turnover. So you find that you're scaling. And what I advise then is that's not a bad thing in itself. That's how it works. So what you do is you reduce how often you use it. So I'll often say start once weekly with the retinol. And then build up to what you can tolerate to. Some people can tolerate to daily, some can tolerate to alternate days, some will never move beyond once a week, but that's fine. At least you get that benefit once a week. So something like the vitamin C tends to try to even out skin color. Like that's one of the things it does. So I've heard people say generally of all vitamin C product that like a lighter patch somewhere, right? I think this place was lighter because of the vitamin C. So I've heard that a couple of times. So that can happen with any vitamin C product. And the way to maybe help that is don't apply on that place until everything else is even,
Okay.
Those are kind of some of the things that can come up with the products.
Okay, so we're going to take other questions. How do I reduce breakouts and acne? Which of your products would help? That's from Ayo Adenuga.
Hi, Ayo. The wash, the alpha hydroxy wash, so the Reveal wash, First of all, that will help with breakouts because alpha hydroxy acids, they strip oil, they take oil away, they help to break down comedones and those kind of things. They help to unplug the skin, and retinol. So those are the two products that really help with acne and breakouts, because retinol, we prescribe retinol in medicine, and we use it for acne. It's a very, very common product we use for acne as a prescription medicine. But now it's coming in a bottle that you can take home without prescription.
Okay, someone just kind of asked my next question that I was going to ask you anyway, so I'll just put it up. Michael or Lagbero says, what's your advice for men? I was going to ask you the same thing because we have different skin textures. We women have different skin textures for men, and a lot of men require different kind of products. So what's your advice for men?
So men can use the whole skincare range. You know how in the stores it's exactly the same thing, but they package it differently for men and they package it differently for women. These are really good products for skin. They have decades, like literally decades of scientific research behind them. They're not random products, so men can use all the product, but I can tell you what my husband likes best. He loves the glycolic wash because he says that when he uses it, that he doesn't get as much shaving bumps as when he doesn't use it. Yeah, and then that kind of darkness, unevenness, it's better with the glycolic wash. So he likes that. Also, I think every man should use sunscreen. Even if you don't do anything else, at least get the glycolic wash because that helps with the bumps, especially black men, because our hair is curly. So you're more likely to have what's it called? Like shaving bumps, that's the word. So alpha hydroxy acid will reduce the risk of that, and then sunscreen, and that's it. So if you can do those two, that'll be more than enough.
Okay.
Good. You can do the range, perfect. But if you need something simple, the wash and the sunscreen
is perfect for men. Okay, that's cool. Let me just take some of the comments because you've got quite a number of compliments. So Adam says you're doing well.
Oh,
and then Adenugo, I think I've taken a question from him. He says, hey Yinka Skin, awesome to see you here, repping Y2K set. Okay. Modukbe Olua says, hey, you're doing well.
Thank you.
And yeah. Modupe Olua also says your skin is glowing, girl.
Thank you.
My skin glowing like that as well. Okay, so let's see what other questions. Okay, Tracy says I was just going to say no to. Okay, I guess that was to when I was trying to practice the laughing with the eyes.
you know the Tara Banks fans know this stuff. The smiles. I remember one episode of my Facebook Live. That's all we did. We practiced how to smile, and people still do it and remind me of it. But especially and now that we've all got face masks, how do people know that How do people know?
Yeah, so we need to practice that more often.
Yeah, I see more than how I don't know how many people I see every day as a doctor. I see more than 30 people. So if you're seeing people and you need to communicate with them with your eyes, what do you do? And you just have to know how to do it.
You just have to know. Yeah, Olu Doyimola. I'm sorry if I'm murdering your name. Ojifini says, and I love the glow and the smiling eyes. Yeah, so we need to practice smiling eyes more often. So I've got a question from, okay, so we've got a couple of questions. Let's just take those now. What effect does, I'm not seeing this well.
Okay, glutathione.
Okay. Have on the skin? How many skin products contain it and claim to help with aging? Okay, I think my glasses are playing a trick on me. Yeah, but did you get a question?
I did. I know what she's talking about. So Glutathione, initially, the story with glutathione was they were using it for patients that were on chemotherapy to help with the vomiting. So they would give it as an IV infusion. And they found that it lightened the skin of these patients. So that was the story, that was the start of it. And then it became a bleaching agent or skin lightening agent.
Wow.
Also, glutathione is an antioxidant, so it helps to get rid of like pollution damage to our skin or to our body. So it became have it as an an antioxidant, yeah, an antioxidant, and then the side effect is that it lightens. So it became a big thing where people would have the infusions and it would lighten their skin. And then we went from people that don't want injections, can they put it on a skincare product? People that don't want injections, can they take it as a tablet, you know? So from no one's going to do this study. No one is going to do this study on if glutathione creams lighten your skin, right? From what I have discussed with people in the industry, the creams don't really do that much. They are not as effective as the injections, right? People say it might lighten a little bit, but not really that much. So for people that are looking for a skin lightening agent, it probably doesn't do much. That's what I've heard from other colleagues in the industry, and actually people that prescribe them and use them for themselves. So what is the benefit? I think the creams cannot do that much harm. If you want to try it, I don't think it will do that much harm. Personally, it's not something like a steroid or hydroquinone. So if you want to use it, it's okay to use it. I think the worst case scenario is it might lighten the skin a little bit, but I don't think it will cause a big bleaching. I don't know because no one's done the big studies. That's the problem.
Okay, but the last part of the question says they claim it helps with aging. So does it help with aging?
And that's what I'm saying. We don't know. We don't know, because no one's going to do this study. So to know if it helps with aging, you get 1,000 people, give them Vaseline that looks like glutathione, give the other 1,000 people glutathione cream. So to judge I haven't seen any studies, and I go into these bouts of researching these topics sometimes, checking, the medical journals, and no one's done any study on glutathione. So, but what I think the conclusion is, if you want to try it, definitely try it or message me. So if you've tried it and you've seen any benefit or you've seen no benefit, if you've ever used glutathione, message me what your results are or what you think about it, and I'll just add that onto my personal research portfolio. But I don't know if it will. There's not a lot of studies saying that it does.
Okay, so if you want to message her, you can get her on Instagram. You can DM her on Instagram at dr.yinkaskin, right?
Yes. And I'm on Facebook as well as Dr. Yinka Skin.
Okay. So Tracy Akwajoto says, can your products be used without prescription?
Yes, Tracy, you can buy them online. They're available without prescription. They are, so like the retinol, I know that came from me saying that the retinol are prescription medicine, but the retinol in DYS is at a dose that can be bought over the counter. So you can order that, it's fine. You don't need a prescription.
Okay, great. So that brings us to my last question, and I think it's a popular question in the house. Everybody wants to know, where can we get your products?
So you can get my products online, dryinkaskin.co.uk. All the products are there. There are 4 products in the range. You can also DM me. Let's say you're in Nigeria, for example. I've got someone that stocks the products in Nigeria, or if you're in other parts of the world and you want to DM me because you're finding it difficult to order online, then just send me a message. I can help sort that out. But they're available online, dryinkaskin.co.uk.
Okay, do you have someone who stocks in the UK as well?
So the products are made in the UK, The stock
Okay.
is in the UK and they're shipped from the UK to the world.
Oh, okay. So we have direct access to the product. Okay, that's cool.
Yes. Yeah.
Okay, that's great, everyone. Okay, so if it's been a very interesting and eye-opening session, yeah. So I've learned at least today. When this show is over, I'm gonna go look myself in the mirror and try and practice the
The smile.
smiling with the eyes, yeah, kind of thing. So that even when I'm out, and then sometimes, before coronavirus, you're out and you see someone and, you can just smile and move on. But now you don't know if someone is looking at you with a smile or they're looking at you like, they're looking at you funny. So yeah, it would be good to practice it. Hopefully that would cheer some people up in a world that looks very gloomy now. Everybody's just masked up and well, we hope we'll get over this very soon. Dr. Yinka, thank you so much for coming on This Week Essay. Everyone who joined us on Facebook and Instagram and YouTube, sorry. Thank you for joining us. It's always a pleasure to have you guys. Dr. Yinka, any last words for your viewers before you go?
Oh, I just want to leave an encouraging word because that's the whole point of this, right? So don't go out thinking, oh, my skin is a mess, I've got this and that. That's not what this is about. Just go out there with your smiling eyes, with your smiling mouth when you can, rock those laugh lines and be amazing, be kind. The world needs you.
Wow. And on that note, we say thank you, everyone. Until next time on Gist with Essay, stay positive, stay happy, stay mended. Bye.